By Rena Pand, MD. When we think about heart disease, we commonly think about coronary artery disease, or CAD, in which plaque buildup leads to blockages in the heart's blood supply. But there are many components to the heart muscle pump, the electrical system in the heart, and other parts, that can go awry and cause heart problems. A common one that women don't usually think about is a heart rhythm problem, called atrial fibrillation, also called AF or fib, which may affect as many as 2.5 million adults in the US alone. The two major complications of atrial fibrillation are a rapid irregular heartbeat and an increased risk of having a stroke. What is atrial fibrillation? Normally, the heart beats in a regular, steady way, about 60 to 100 times per minute. In atrial fibrillation, the heartbeat is disorganized and irregular. What kind of symptoms do patients feel? The most common symptom is palpitations, which can be a sensation of an irregular, racing heartbeat, a fluttering in the chest, or the sensation of the heart skipping a beat. Other symptoms can include lightheadedness or dizziness, shortness of breath, weakness, or chest discomfort. Interestingly, some people have no symptoms at all. Why do people develop atrial fibrillation? In some people, particularly younger patients, there may be no obvious cause. And the most common cause is older age. But we will sometimes look for treatable causes. These include thyroid problems, drinking too much alcohol, taking in too much caffeine or other stimulants, high blood pressure, sleep apnea. Other known heart problems, such as an enlarged or weakened heart muscle or having leaky heart valves, can predispose to it. What are the treatments for atrial fibrillation? Many people can remain in atrial fibrillation as long as they are treated with medications to keep the heart from beating too fast. Those who are at increased risk of stroke may need to be treated with blood thinners. In some cases, we need to get patients back into a normal rhythm either with medication or by shocking the heart back into rhythm. Are there any special considerations for women? Women with atrial fibrillation may be more likely than men to have symptoms, feel palpitations, and may notice faster heart rates. Women of childbearing age need to be particularly thoughtful when considering use of blood thinners because certain blood thinners like Coumadin or warfarin are not safe to take during pregnancy. In addition, being on blood thinners can aggravate menstrual bleeding. You should always feel free to discuss any concerns with your doctor. Atrial fibrillation can really only be diagnosed with an electrocardiogram, ECG, or a wearable heart monitor. If you or any of your family members have symptoms that suggest atrial fibrillation, it's best to talk to your doctor so you can get diagnosed and treated.